Welcome back to part 2 with Dr. Vodjani. We're talking all about peptides, what they are, how they work, and why they're suddenly everywhere. He's back with us, and we're continuing the conversation. Let's jump back in.
Let's shift into peptides more broadly, because this is something that we're seeing everywhere right now. So can we just go back and highlight, like, what exactly are peptides and how are they used in functional medicine?
Yeah, I like to explain them in kind of this like maybe overly simplistic way, but I think it makes a lot of sense. I consider medications and supplements a off switch, and I consider peptides an on switch. So you're kind of doing something very different. You're taking a body's natural ability and flipping it on in a direction that you want, right? In the case of thymosin alpha 1, what you're doing is you're using an immunological on switch. And it's an on switch that we all have up until maybe 19, 20, 21 years old, because we have a gland underneath the thyroid gland called the thymus, which is responsible for training and regulating the immune system. By the time you're 20, 21 years old, it disappears and you lose all of that signaling to your immune system. So all you're doing with thymosin alpha 1 is re-engaging some of the programming that happens when we're a little bit younger, bringing some of that youthful balance and resilience. Okay. Why are they so popular is, I think, a really important question. I don't have the full answer for it, but no doubt 2025 was the year of peptides, and it's not slowing down in 2026. Part of it was regulatory signal change. We still haven't gotten full to the point where we have full regulatory approval of the FDA, but it certainly is signaling in that direction. And I think the other part of it is just how people feel on peptides. I mean, people start experimenting with it, talking about it, sharing, stories with friends, and the next thing you know, it just catches on like wildfire. And, it probably was the most popular topic of discussion in our clinic in 2025 from things that people brought to me, not me bringing it outward. I think it's just kind of telling overall of like the direction medicine is going in this country. I think a lot of people are very fed up with the lack of diagnostic thoughtfulness, treatment options available, and there's kind of this like grassroots movement towards doing something in a completely different way. And functional medicine, and I think peptides are kind of part of that grassroots movement.
Is there any kind of testing that should be done first specifically for peptides that someone should know before starting them?
I mean, immune peptides, I always test what's called the immune phenotype for somebody. That means I do this very complicated test where we're looking at all of your B cells and your T cells and seeing which ones are strong, which ones are weak. Does the benefit profile of TA1 match your strengths and weaknesses? Right. So it's not a peptide that I would ever tell anybody just use in the dark without having somebody kind of check your immune system ahead of time. Very clear with that. There are other peptides that, healing peptides, BPC 157, TB 500, those are things that people use for healing, a meniscal tear or a rotator cuff or something all the time. Probably happens millions of times in the US on at this point in an annual basis is my guess. And, we haven't heard anything negative happening out there in the community with those situations. I still think it's better to do it under medical supervision. There are certain peptides that need some testing before others that don't need any testing prior.
It's just fascinating to me because I see so many people promoting these peptides as if they're like a cure-all and you should just be taking all of them. And people really don't know much about them and what they're talking about.
Yeah, you have to be really careful. I mean, social media is this place where people talk in extremes on one end or the other. There's never kind of a grounded middle space, which is why I started writing a Substack.
Which is helpful for people who also can't get access to you. I think there's so much great information there that you can also bring to your physician.
That's a big reason why I started putting the info out there. In this world of extreme, you'll get people who say every peptide in the world is, magic. You should be on 6 of these. These are the ones I take. This is what you should be taking. And then you get the other end of the spectrum. People say there's no quality control on peptides. Nobody should be using these. The truth is always in the middle. Yes, you want to be purchasing peptides that have good quality control to them. You want somebody helping you, making sure that you're using them in the right context, that you're using them for the right amount of time, that your dose is correct. Not every peptide is magic for everybody. Some of them can backfire. The middle is the truth there.
Yeah, just taking peptides doesn't make you an expert on peptides.
No, the
Thing that I'm
peptide
seeing
on Reddit are definitely, they think they've got a PhD based on their usage, but that's certainly not the optimal way to do things.
And that's why we brought you on here, because it's the first time I've ever heard of thymosin alpha-1 before you brought it up to me.
There's a question about peptides being used for weight loss, skin concerns, wrinkles. Are any of those effective?
I'm guessing that's a GLP-1 receptor agonist question. So we've got semaglutide, tirzepatide, and I'd say 2025's darling was retatrutide, which is kind of the evolution of these GLP-1s. The real difference is has a tendency to speed up metabolism versus the others tend to kind of like work on your actual hunger drive and food noise. Anytime you're using these like weight loss peptides, there's always the potential for skin changes. Again, going back to our last podcast, you can't use these peptides in isolation. They have to be a part of a overall program of diet and exercise and anti-inflammatory living, and sometimes they're a really useful kind of adjunct to those things. But if you use them as the sole driver, a lot of tissue problems can happen. Those are probably the most common issues you'll see if you're not doing that in the right way.
Well, what are the tissue issues that you're seeing, like in terms of the skin and what it looks like?
You're using those peptides in isolation and kind of hitting them hard. It starts what we call the catabolism pathway. So the breakdown pathway of the body gets engaged in this powerful way. So yes, you're going to break down fat, but you're also going to break down collagen, and you're also going to break down muscle. And your body has to live in balance where it wants to build and kind of break down the tissue that it doesn't need anymore. But you can't be solely in the breakdown pathway, otherwise the manifestations are not great.
What about like the over-the-counter skincare products with peptides? Do you think those are effective?
Topical peptides or oral peptides are very interesting. The topical peptides that are getting used for skincare, I have actually seen be effective. They're peptide that's like the center of those is something called GHK-Cu, which is a copper peptide that really helps collagen growth. They seem to be safe without any issues, and they definitely seem effective if you're buying them from a reliable source.
With like thymosin alpha-1, going back to that. So what's the hope at the end of like my protocol, let's say?
Again, the way thymosin alpha-1 it works is that it takes the antiviral deficient and pro-inflammatory immune cells and it regulates them. So you're lifting up the antiviral portion, you're decreasing the pro-inflammatory portion. So the goal is actually the immune rejuvenation. And when we did your immunological workup, Natasha, what I call the Navy SEALs of your immune system, the guys that are kind of sent in, they were unfortunately wiped out. And the real purpose of the peptide was actually to kind of bring those levels back up, get your immune system back online. And from there, the Epstein-Barr virus clearance occurs. So the end goal is a balanced, functional immune system, which is probably the most important thing to develop in your 40s and 50s based on the literature as far as a longevity perspective is concerned. The people who develop immune regulation or balance in their 40s or 50s live on average 15 years longer than people who don't.
So we got so many random other questions for you. One of them, we always get this question about hair growth. I know you guys work together on Natasha's beautiful hair growth. And what does work? Like, what do you test for? Does Nutrafol work? Like, what's your take on hair growth?
Hair growth is the perfect personification of like what functional medicine really represents, where you're not looking at one particular area. You are looking at the body as a whole. So number one is inflammation. Number two, thyroid function. Number three, micronutrient status. Iron, B vitamins, all those things need to be looked at. Iodine, right? The bigger part that I think is the most important thing is answering the question, why did this occur? Let's say you've identified there's chronic inflammation, there's thyroid dysfunction, you're not absorbing nutrients the way you're supposed to. The most important piece to pick up is what is the central root of all of those things. Oftentimes it's gut dysbiosis or gut inflammation. So when we're doing hair restoration work, it's always, hey, what am I replacing that this person has been deficient? What am I also fixing internally to make sure that doesn't happen to them again? And there's no easy answer. Nutrafol is a very decent multivitamin that covers a lot of the micronutrient bases, though it's missing iron. And there are some other herbs in there that might help with DHT blocking, though, that's probably a small percentage of hair loss out there in the population. So it's a fine starting point. Collagen also tends to help as well, but those things never answer the question of like, why did I need this? Is my diet missing? Unlikely, then why am I not absorbing what my diet is providing? Ends up being the bigger question.
All I know is that when I started adding those trace minerals with zinc and copper for a few months, like my hair started growing like crazy.
But now that I hear him, I wonder if the bone broth you're doing every day too is like a huge...
Well, yeah, I drink bone broth every day for the collagen.
Yeah, the amount of collagen that's in bone broth is very bioavailable, and there's a big amount in there. So that tends to be a great nutrient for hair growth. But the way it works is not the way people think it works. Like, you think I'm drinking collagen, that collagen is going to my skin and my hair. Unlikely. What's happening is it's lining your stomach and making your intestinal tract more capable of absorbing nutrients. That's very likely how collagen works.
Oh, that's so fascinating. What do you think about all the collagen powders?
That's how they work. You ingest them. Your lining of your intestinal tract is very rich in collagen. The lining of your intestinal tract turns over every few days. So you're just rebuilding a healthier layer of your intestinal tract when you're taking it, allowing you to absorb more nutrients, makes your skin and your hair stronger.
Maybe I'll start drinking that bone broth with you. Yeah, I've been eating the egg thing that Natasha told me to do.
It's like a thin layer of, when you peel an egg and you have like that thin transparent layer. It's like collagen.
That's a good one. Are you eating the shell too?
No, I don't eat the shell.
Some people eat the shells.
I save my shells for my chickens so that their eggshells are stronger. Wait, now that we're on this, what about, this whole colostrum?
So the concept with colostrum is that's the first milk of the animal. And what's the purpose? We as human beings produce colostrum as well, right? You're giving your child passive immunity. So they're ingesting antibodies that line their intestinal tract, helping to shape the microbiome, prevent infections. When you ingest colostrum as an adult, it does very similar things. I am personally a bigger fan of a different style of product that does similar things, which is called serum bovine immunoglobulins, or SBIs. Colostrum is taken from milk, right, from dairy cows. SBIs are derived from blood and then filtered and purified into an antibody-dominant product. Why do I think that that's a better thing? Number one, there's no dairy protein in there, and some people do react very significantly to dairy protein. Number two, that's a medical food, meaning it's regulated by the FDA. There have been very, very nice studies done on what the product actually does, what it binds to, what dose is efficacious. Colostrum is a unregulated product. We don't know how much antibody is in there. We don't know what types. We don't know what they bind to. When you ingest SBIs, serum bovine immunoglobulins, you know exactly which bacteria they're binding to, how much antibody is in there, what type. So I like SBIs a lot more than I like colostrum, although the marketing around colostrum has been very inspiring for the last couple of years.
Lots of marketing. Where am I buying SBIs?
There's two major supplement companies that have it. Microbiome Labs carries a product called Mega IgG 2000. And then Ortho Molecular carries a product called SBI Protect. Ortho is a direct...
I take that. I take SBIs already. Yeah, but that's like really good for gut issues, right? Like that's why I take a lot of that SBI. It's super expensive, by the way.
It is relatively expensive, but it's a great microbiome supportive, immune supportive product in general. And I mean, colostrum's not cheap either. So, like the percent difference between the two of them isn't as big as you think it is. And I think the SBIs are a better product.
We received hormone and metabolism questions. if someone lives an 80-20 healthy lifestyle, this is according to them, but still has high estrogen levels, what could be contributing to that?
I mean, it really depends on what 80-20 means. Is the 20% things that are impairing your liver's metabolism of estrogen? Are they, changing the way the ovaries produce estrogen in relationship to the rest of the body because the brain isn't seeing the estrogen the way that it should? I mean, there's a million potential problems there. The analogy that I picked up from Amy, our nurse practitioner here in the office, is like,
who is the best? We love her.
Think about your roof leaking. Do you want your roof leaking is 20%? Is that better than a roof that, is leaking 50%? It's still leaking. So it's still a problem. I'm not saying everybody needs to live at 100, but 90, 95 tends to kind of be the magic zone where things tend to change for people.
I do think that you hear a lot. I mean, I hear a lot of people say, like, I'm just having McDonald's today, 80-20. It's like, okay, we've reached this point where 80-20 is not 80-20.
True. I'll tell you one of the funniest true stories that happened maybe 4 months ago. I had a patient who came in for a consultation. It was her second appointment, so we were going over all of the labs, and I was looking at her food sensitivity profile, and she had a really significant reaction to gluten. And she happened to walk in with her lunch, and she was eating it during the consultation. And I asked her point blank, like, how would you describe your eating overall? And she's like, well, I think I'm a really, really clean eater. What she happened to be eating at the time was a corn dog from 7-Eleven.
Oh my gosh.
And I just think sometimes it's like people want to believe in the best of themselves, and that's sometimes separate from reality. And my job is always, to make sure that we're making healthy but not obsessive pushes towards better.
I think people's definition of healthy is so skewed, and people don't really know what healthy truly is. And there's no actual definition of an ultra processed food. People think, oh, like I don't eat, ultra processed foods, but in reality, dressings are ultra processed foods that they put on their salads. Like they just think that, oh, that's healthy. That's a salad.
You understand how we got there, right? Like we're all very, very busy. Society is kind of like, in this crazy, chaotic place these days. We haven't created the time for us to be able to slow down, purchase real foods, prepare the real foods. Kind of like that ritual in the house is lost for a lot of people. The ritual is now just, ordering whatever your usual go-to for that night is and having it delivered. And I think the real definition of healthy food is just kind of taking control again of how that food is prepared and what the source of it is. That's really all it is. But that requires effort, and it's a lot of work. And, I think there's probably no better place to invest time and money as far as your health is concerned. But it's hard to get people to kind of acknowledge that that's where they need to go.
Let's talk about mold and mycotoxins, because so many people have questions about that. Are there blood tests for mycotoxins? Are they reliable?
The overall problem that can happen for human beings when they're exposed to mold tends to happen in two ways. Number one, there's the actual exposure to the species, which tends to drive the microbiome in a negative position. And then there's also the exposure to the toxin of the mold species itself, which we call mycotoxins. There are companies that will offer urine mycotoxin testing, meaning you're just looking at what you pee out. You don't know whether those mycotoxins originated from your outside environment currently, your inside environment, from what you ate, from your microbiome. All you really know is that that mycotoxin is kind of exiting at the time. They're useful, but they have to be understood in context. My dad started blood-based mycotoxin testing in the 1990s and did a lot of work with Mark Hyman actually back in the day in that space. If you kind of go back to my podcast with Mark in 2024, you'll hear Mark tell that story at the beginning. I won't get into a lot of detail, but essentially after that test was used to helpfully litigate against home insurance companies, the state mandated that my dad didn't run that test anymore. And now there's nobody in the United States that is doing blood-based mycotoxin testing, I think, based off of that history. It's hard to know how reliable they were because we've come a long way in 30 years. There is one company that's doing blood-based mycotoxin testing. They run it out of Mexico. It is based on my dad's ideas and tech. I don't endorse or not endorse the use of it, as I feel like there are lots of other ways to try to understand how mold and mycotoxins are impacting a person. That really comes down to what's the current status of someone's immune system. I also don't believe that mold and mycotoxins are the isolated culprit, as far as like someone's immune system is concerned. A lot of people get very, very laser focused on them. And it's not to say that they're not meaningful or impactful, but the bigger, again, broader question is, why did your immune system start freaking out about the mycotoxins or mold?
Because it's interesting, like if you're in the same household, some people can get so affected by the mold and some don't.
Because everybody has their own pathway that they walked up until that moment. What were their environmental exposures as a kid? What did they eat? What have they been exposed to from a viral perspective? How many antibiotics did they use? What are their genetics on their detoxification pathway? That all dictates how you do when you finally come up to the actual exposure. I think the point is that, when you're trying to understand how to come out of it, it's really about rebuilding the resilience. Some people, unfortunately, get stuck in the idea of, I need to come out of the mold and be out of the mold for the rest of my life, and that's the only way I'm going to exist, which can be harmful in its own way, because that's not really possible. Again, picking up all the pieces of what does the immune system say it's not happy with in your environment, mold, chemicals, whatever's going on in your gut, viruses, repairing every piece that you possibly can, because that's how a signal of safety or resilience is kind of brought back to the immune system. So mold is always part of the workup and part of the work, and it's definitely something we focus on, but it's important to not be tunnel visioned with mold.
I think that's a really important point. What are the best ages to test children's nutrient levels, gut health, bacteria, make sure everything's on track? You have kids. We all have kids. All our mom listeners here. When can we start taking them to you?
I would say in kids, doing something called organic acid testing is probably the most reliable way to get at least the highlights of this. Organic acid testing is a urine test where you're looking at the byproducts of different pathways in the body. So you can see certain types of fungus and bacteria and B vitamins and vitamin C and glutathione and some of the neurotransmitter stuff as well, though there's some debate about the reliability. But overall, in a kid, you probably don't want to be poking them, 4 times a year to get that data. But periodically doing an oat would be maybe the most helpful way to do something like that. That's how we manage my kids, who are 4 and 7 currently. When you get to 15, 16, 17, 18 years old, then you can start using some of the adult methods. But the kids, I think it's very important. They need to be willful participants in that. It tends to go the other direction when it's the mom or dad who's like, hey, I really want you to do this. It's important for your health. And the kid has no interest in it.
Can anyone do that organic acid? What is it called?
Organic acids test.
I believe there are companies that will sell you organic acid kits. We use Mosaic as our brand that does it as a layperson without a provider. I think Rupa specifically will allow people to do oats. It's a very complicated test. And again, you can't just look at the page and get some interpretation that's helpful. You need context. Yeah, I don't recommend people doing it. I think it's better under the guise of a practice.
Yeah. Okay, good. Well, we are always so appreciative of all your knowledge and all your help in getting us healthy. And is there anything you want people to know? We highly encourage, without him even telling us to say this, that you follow his Substack. Not an ad for his Substack. We just really are big fans of it.
It's really so helpful for everyone out there.
Thank you. I appreciate it. It's always great talking to the two of you. And thanks for the opportunity to share some knowledge out there. So thank you.
This podcast does not constitute medical advice or recommendation. Please consult your doctor.